more than 2 years ago. In 2017, we as African Institute, because of our role in policy and knowledge management and using that to inform the programs that are done for children and communities welfare, we did identify the gap in mental health services. And we did a needs assessment that looked specifically on special needs offenders.
Special needs offenders are persons in the criminal justice system. And of course, for one to be called an offender, they have gone through the process and they have been found to be guilty of what they were accused of. But we have needs that require the justice system to kind of make extra effort, the agencies in justice system to make extra effort to help them. So some of those needs are like subjective needs, like for example, they have hearing impairment, maybe they have underlying mental illnesses, maybe they have, they have needs, and they also have objective needs that have been identified through assessment by various professionals, as a result of that assessment, they have been found to have certain conditions. Like for example, maybe they have psychological disorders, they have intellectual disorders, they have like physical disabilities.
In Mathare, there are over 20 of them, some of them with more than 20 years. Last year, unfortunately, we lost one person who had been on the waiting list to be released. And it's because the law as designed is you can't plead guilty if it's confirmed that you have a mental disability or mental health condition. So this project is therefore designed to provide model of how do you handle such a case. Can we do a non-institutionalized correctional service if there is anything like that? And I say like that because many times the case has not been determined. Or how do you assure the human rights of this person? We also did appreciate from that project that for that to happen, and not just for persons in prison, but for anyone in the community, you need access to health services. And this needs to be sustainable, so community-based. You also do need access to community-based rehabilitation and reintegration, because we're saying every human being deserves to be in a space that they call home with dignity and not being captured within institutional care. This program is providing a model on how to do this too. We have clinical services being provided by Kamili organization as a partner. And then we have KAI, the Kenya Association for Intellectually Handicapped, who have done a good job in providing community models on how to support persons with intellectual disabilities.
In the project that we work with AICS and Kamili, our core mandate in the project is on access to justice for people with intellectual and psychosocial disabilities, to support them by facilitating intermediaries for them to be able to interface within the justice system, from the reporting stage at the police station to the courtroom, where we provide supports all through. We also work with prisons and mental health facilities to ensure that already those who are inmates within the institutions are reintegrated back in the community. And for this, we have like three-pronged way on how we do it. So the first one is to work with families and communities to ensure that we create awareness on the rights of people with intellectual and psychosocial disabilities in the communities, and for the communities to embrace them as, part of human society. But most importantly is to ensure that we have community-based services so that people can easily access them within their communities, and they should be affordable, available, adaptable, and friendly to them. Then the second component of this is identifying already the ones who are in the system and trying to reintegrate them back in the community. So at the moment we are working on like around 5 pilot cases that we want to reintegrate back in the community. We've already visited Meru and Kitengela prison, And from Kitengela prison, we've been able to reintegrate one person back in the community who we found in remand, and it was a petty offense because he was being accused of stealing from his employer, which was just an accusation, and it was just an assumption because his co-workers are the ones who stole. But since this one has an intellectual disability, then it was very easy to frame him, and he found himself in the remand. And then the third part of the reintegration is that we're taking lead in the consortium in developing a reintegration policy, working very closely with the probation. And then also we are working on a model, which we are calling it a KAI model, whereby we are showing the steps on how to reintegrate and how to embrace people back in their communities. And for all this, we don't use the medical model of doing it. We use both the social and the development model, picking it from the Convention on the Rights of Persons with Disabilities, where we are saying, when people are supported, when people are facilitated with accommodation and supports, then they can live in the community on an equal basis with others.
Ultimately, health as a service is devolved, and therefore you do need the counties have a primary role in providing that service. So in doing our model interventions, we are working with 2 counties, Meru County and Kajiado County, to promote ownership of these interventions and have it ultimately within public financing. Personally, I believe that the rubber of human rights works out when it goes into financing.
I just want to appreciate what the African Institute of Children's Studies has done and the work they have done in this facility, Kitengela Sub-County Hospital, in terms of mental health services. This is one of the busiest public hospitals here in Kitengela town and Kajiado East at large. We have a catchment population of 56,000. In fact, we are serving clients from the neighboring Machakos County and Nairobi. And so we are very busy. And over time, we were lacking one particular service, and that is mental health. So in 2019, through the support and partnership of African Institute of Children's Studies, they were able to train one of our nurses for this psychiatric course. And then last year in 2020, she came back. We started a clinic.
Since then, we've been able to, the number of clients have increased. From the time we started, we were seeing around 20 clients, and up to now, where we've reached, we are seeing around 80 to around 100 clients.
We were able to get all of these, some of these clients, and so far they are receiving the much needed mental health services. So we really appreciate for that. And even the capacity building in terms of the regular trainings that they hold, and also the occasional and regular outreaches that they hold. And it has gone a long way, and we are hoping that in the future, these services will be strengthened. In the future, we are hoping that we can have more and more of our staff trained on mental health so that they can come and create awareness and offer these services, because even the one that is here is already being overwhelmed by the numbers that are there. So
there is need to employ more, and there is need to train more. That is, nurses can be trained on psychiatry, on psychology, clinic officers can be trained on the same, even medical officers, doctors can be trained on psychology or psychiatry. So we need more training so that we can cascade mental health care to the community level, from the county level to the sub-county level to the community level. We need a good structure. I mean, I being the coordinator, we can also have coordinators as a sub-county level and at the hospital levels, our facility levels, that is dispensaries and health centers. I would also want to see that we have all we have mental health intervention, even the dispensaries in the community. Community health volunteers and community health assistants should have some skills on how to assess somebody with mental illnesses and how they can refer. We are not supposed to stigmatize mental illnesses, because people with mental illnesses are often stigmatized. They are also discriminated when it comes to jobs and other things. So there should be no stigma on the issues of mental health. When you see somebody with mental illnesses, you should view that mental illness as any other illness, like malaria, like typhoid, like brucellosis, like any other condition. So they should not be stigmatized. They should be helped. It's a condition which people can get healing just like any other condition, and they should be assisted so that they can live a meaningful life.